Okay, let's go ahead and call the meeting to order. Jennifer, would you please take roll call?
Yes.
Thank you.
614, President Haugley,
Present.
Vice President Carter,
Here.
Secretary Heron. Here.
Muted,
Her present.
Emma.
Sorry, thank you. Present.
Thank you. Commissioner Bowers,
Finally present.
CEO Jensen,
I am present.
CNE Ralston,
Present.
CFO Ritter,
Present.
COO Moore,
Here.
and General Counsel Hauser.
Good evening.
Thank you. When we do have guests, and if you would write your name in the chat, that'd be wonderful. Thank you. Commissioner Haugley, I can put the agenda up if you like.
I have it here. Okay, let's go ahead and ask, I'd like to call for approval of the board meeting agenda. May I have a motion to approve the board meeting agenda?
So
I
moved.
move that we approve the meeting of the agenda.
Second.
May I have a second? Thank you, Mark. Very good. Commissioner Bowers and Commissioner Heron. Hearing a first and second, call for the vote regarding the approval of the board meeting agenda. Please signify by saying aye.
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 Opposed? Abstaining, we have 4 ayes. Motion carries. Thank you very much. Now we move on to public comment. We always we have the meeting option for any members of the public that would like to share any comments limited to 3 minutes. Please state your name and where you reside if you wish to do so. At this moment, please go ahead.
I would love to take the opportunity if I can.
Thank you.
Yeah, of course. I'm Megha Shah. I'm a practicing physician and employee of the district and serving as medical director of hospital services at Snoqualmie Valley Health. I've been here for almost 2 years now. And in my time, honestly, I've had the opportunity of having a front row view of what it truly takes to build a strong organization set up for long-term success. I've noticed that our greatest asset has been our people. And in my about almost 20 years of working in healthcare and leadership here and there, training, working, I really feel like this is the one place where I found the staff engagement was so high, whether it is medical staff, it is nursing, behind the scenes, it is lab, rehab, whoever's touching the system in any way as an employee of Snoqualmie Valley Health, the engagement has been so high, which got me to thinking that level of engagement doesn't happen by chance, right? It reflects how intentional and disciplined our leadership team has been in who gets to join the SVH team. They've set the bar high, they've held the bar high, and they've asked us to hold the bar high when we are looking for team members for joining our team. When we are seeking out individuals who are not only having the right skill set, but also the drive to really translate this vision we all have for the community into reality, and the humility to be part of a team and work as a team. They've always asked us to consistently prioritize finding the right fit and a shared vision, a shared purpose when we are looking for new team members to join us over speedy or convenient hiring. And the result can be seen. We have a very cohesive, high-functioning team that shows up every day and wants to show up every day to work to serve the community in the best possible way that they can. It's a team that takes pride in belonging to SVH. And with that, I also want to acknowledge that there is a significant responsibility before the board members today, selecting the right board member to help guide us and support us through the immense and incredibly important work we are doing for the health and trust of the community as we have taken on this giant project to transform the way healthcare is in the district. And I hope that decision is made with as much intentionality as our leadership team has asked us to exercise thus far to build this SVH team. Thanks for listening, and yeah, thanks for the opportunity.
Thank you so very much.
Yeah.
Well stated. Anybody else from the public care to make any comments for the board? And would anybody else care to make any public comments this evening?
Is that me or Renee? I don't know the.
You get
Right,
you
rules
get
here.
your own time on the agenda, Brian. So no, you just hang
Okay.
tight. Thank you.
And hearing no further, I'll go ahead and move on to the next item on the agenda for this evening regarding the consent agenda. May I have a motion to approve the consent agenda?
I move that we approve the consent agenda.
Thank you. Was that
second.
Commissioner Carter?
I second.
Okay, Commissioner Herron, thank you. We have a first and second. All those in favor, please signify by saying aye on the motion to approve the consent agenda.
Aye.
Aye.
Aye. Any opposed? Hearing none. Abstaining, hearing none, motion carries. Thank you very much, everybody. Okay, let's move on to our patient's story.
We
Renee?
have a treat for you tonight. The patient story is my favorite part of the meeting because it really reminds me how much our work can impact and change our community. And sometimes you come across these stories and they're just better told in person. And so tonight we have Brian Sandals joining us in person to tell you his patient story, our patient story, his patient story. And it's very touching. And yeah, and Brian, I think I'm just going to leave it at that. And I know in your introduction, you'll explain who you are and how you know the district. But Brian's a very, very special person to us. And I'm excited for him to share a piece of his heart with you tonight. So Brian, I'll turn it over to you.
All right, thank you. So I'm Brian Sandal. I'm the senior superintendent on the job on the hub, which is awesome. But more to it, I got to see the other side of the hospital recently, the opportunity to see it. So I'm married. My wife is Dixie Richards. She came down with glioblastoma a year ago, and she had surgery, I'm going to call it 2 months ago, and needed rehab. I'll tell you a little bit more about me or us, and then I'll move on to the kind of the scenario. So we've been married 29 years. She's my best friend. She's currently in hospice at our house, and she's doing well, much better than they expected, which is awesome. Very little pain, still laughing, so has good sense of humor. And we're currently expecting a granddaughter on June 14th, which is kind of our goal for her. I mean, obviously more is better, but at least we have a goal. So the scenario is last June 15th, we got the news she had a seizure, and we went to the hospital and they found masses. We did radiation for 6 weeks. MRIs looked good until February of this year, and then they started seeing growth. Anyway, there's a tumor that showed up affecting the right side of her body. So she was having a hard time getting up and down the stairs. And so we opted for a surgery that was kind of I'm going to call it a whack-a-mole method for lack of a better term. But there was one tumor, and we thought there was a chance that we could get it and then continue her life so that she could see her granddaughter. I mean, that's the goal. The surgery didn't go as planned, and she got paralysis on her right side, and she needed rehab. And we were Swedish. And of course, I don't know how many of you have been in the situation where you've had a loved one that's sick or ill or whatever, but there's a ton of stress, and I didn't know what to expect. And this is my first time, and it's not something I want to do again. But they send you out with this, like, here's rehab centers that are in the area, and good luck. That's basically what they tell you and send you on your way. Well, coincidentally, at that same time that this was going on, Neil had joined the fund down there at the hospital. Not quite been hired yet, I guess, but Neil and Renee were talking, and Renee found out about my scenario and called me. And she asked how she could help, and I told her about the rehab center that I was looking for, and the ones that I saw were no place that I was going to put my loved one. And she recommended SVH and that she would put her family there. And I couldn't agree more. So that's kind of the scenario and me and my wife. But what I'd like to say is that let me get down. I have notes because I have ADD and I will totally miss stuff. So bear with me for a minute. Yeah, I went through that. So anyway, the great results is, one, I work at the hospital across the street, and then I got to see the inside of the hospital and how it really worked and how community driven you guys are. And I've heard this from the very first day when we did the interview with y'all. And it's true and it shows, and it's amazing. I'd like to say the rooms are super nice, super clean. Probably the best I've seen in any hospital I've been in. Should be proud of that. The PTOT teams couldn't be any kinder and more helpful. And if you think about the fact that Dixie has that's my wife's name, Dixie, I'm sorry, I probably didn't say that, has glioblastoma, and we know what the outcome eventually is going to be. These folks treated her like she was going to live for the next 100 years. I mean, they literally jumped in and they were so good and so nice, and they pushed her. She got so much better in the hospital, and they taught me so much about caring for her and stuff. It really went a long ways. So I kind of want to call out a couple of nursing staff and stuff, but I have to admit that I really wasn't thinking much about this until towards the end of our stay, because stressed out and working and doing all the things. So I'm unfairly not mentioning people. So take that for what it is. And assistants. So Leah, I don't know anybody's last names, and I apologize for that. Leah is an assistant nurse or an assistant to the nurse. I don't know how it works. Anyway, she was amazing. She was number one in super happy, made Dixie happy, always making sure that she was comfortable. And I'm sure she is for everybody. She has a ton of energy. She was definitely the one that stuck out the most. Sean and Scott and PJ all stood out as well. And I think they went above and beyond making sure that she was comfortable. And I think they do it for everybody. It's not that I think we got special treatment, but it felt like it. Let's go with that. Susie knocked it out of the park, got us in there, knew everything that was going on, all of our trips where we were going. And I'd say that was true for everybody. The fact that you guys post in the room, on the walls, where you're going, how you're getting there, everything set up, it put me at such ease because I'm a planner. And so when I can see that everything's handled and everything's going to go well, it made my life a lot easier. Lisa took the time to go through everything with me and kind of explain how things work with PTOT. I really appreciated that. Nicole, I can't believe how many jobs she has, but she is all over this hospital. I never realized, but anyway, amazing work. Of course, Tammy and Renee. And like I said, there was many, many others. I also wanted to mention the kitchen. Oh my God. I don't know if you've ever been in a different hospital before, but this hospital is awesome. The food here, every single day, the food was good. It was different. The staff were so nice and so patient. I can't even tell you, like, I would have gone out of my mind talking to my wife about making a decision about food. And they just coached her along and got the food, and she loved the food. And it makes such a difference. It really makes a difference on how well you do. And that's the entire staff. A couple of the extra things in the rooms, and I don't know if they're extra or not, but what I took away and what I liked is, like, they made a note when she was on, I'm going to call it Oxy or any kind of a drug that was changing her, so that I would know, and they were fairly communicative about that. The nurses and assistants and stuff and PTOT and everybody training us at the end and taking the time and making sure that we knew how to take care of Dixie, because she's home now and literally it's all on us. And if I didn't have that experience of being there and seeing all that and being trained, I wouldn't be doing well. And I think she's doing excellent right now. The natural light and the blinds, it seems like every room's on the exterior and there's natural light, and the blinds and stuff for night and day, and keeping her kind of on the right cycle is great. Yeah, I think that's it. You really a fine job. I'm so impressed, and I'm so proud to be working for you guys and be able to put the new building in, and I'm super excited to see how it all goes together and it all turns out with the public. So there you go.
That
Brian,
is-
thank you
so
so
much,
much for your
Brian.
bravery and sharing your story.
For sure.
Yeah, Brian, thank you so much. And your message will get back to the team for sure, and will fill their cup and their bucket and their heart so much. So really appreciate you coming here tonight.
All right, well, I appreciate it as well. Let me come here. Thank you.
Thank you for trusting us with her care, Brian.
Thank you.
All right, commissioners, I couldn't not bring you that story. It touched my heart, and it was a stretch for us to be able to help Brian and his family, but it was a team effort from Tammy helping to get it to pre-auth and the team to be able to get Dixie accepted. We were able to get one of our team members was able to make sure we had an extra bed so family members could stay alongside her while she was here. And we just gave Brian the SVH love and returning the favor that he was doing and helping us build this hub. So Brian, thank you.
Yeah, thank you guys so much. I really appreciate it.
Thank you,
You're
Brian.
welcome.
Thank you.
All right, Commissioner Hugley, on to Commissioner Business.
Okay, Commissioner Business, special board meeting. Excuse me. Under the Washington State Legal Summary, Renee?
Yeah, so we've got a special guest with us tonight, Beth Zarowski. She is joining us from the Washington State Hospital Association, is going to talk a little bit about what's happening in Washington State policy and give you a little bit of an update and tell us a little bit more about how commissioners can get involved. Beth, thank you for spending your evening with us.
Thank you, commissioners, and CEO Jensen. So glad to be here with you, and it was wonderful to hear that story as well. Those stories are the reason I stay with the Hospital Association. I've been with the Hospital Association now for 18 years and work on advocating for policy for hospitals in Olympia and Washington, D.C. with our team. And I do have some slides to share with you tonight. Jennifer, I don't know if you're able to pull those up. Thank you so much. So it's great to see so many faces that I recognize from WSHA events, and we really appreciate you being involved with us. So the Hospital Association, we are so proud to have all of the hospitals in Washington State as members. And with that, we work very closely with another organization that Snoqualmie Valley Health is involved with, the Association of Washington Public Hospital Districts. And both of our organizations provide a united voice for hospitals on issues impacting the ability to sustain local healthcare services. So I wanted to give you a little insight into how we choose what issues that we're advocating on, and share a little bit of the results of the recently completed legislative session, tell you what's happening in the interim, and then talk about how we are able to gain access to lawmakers and develop relationships with them to help successfully advocate for good public policy. So first, the Washington State Hospital Association is very much a member-driven organization. We have a governing board that is made up of member CEOs, and we have several committees that focus on issues from clinical excellence to public policy to governance education, and data analytics is our newest committee. And all of those committees have a role in helping define where our advocacy priorities are each year. You all know that we have a lot of diversity in the types of hospitals we have in Washington State. We have large urban hospitals, we have small critical access hospitals, we have independent hospitals, public hospital districts, and a couple of for-profit hospitals. And what we look for is those issues that are common across all of these hospitals. And often as we go through the process of bringing ideas and issues forward that we think may be of interest to our members, as well as members bringing us issues that they think there might be a legislative solution to. We come up with a list of issues and bring them to the membership through those committees, and we actually have members vote on those and prioritize what's the top priority for them. And if there's an issue where members are divided, we often will not take a position on that. If there are issues that benefit one type of hospital over another, often hospitals will actually say, hey, if this is going to make a material difference to you, we are going to support you in that. And we want to lend our voices too, because we need the whole system to be working well. We need smaller hospitals to be able to care for their communities locally. Small hospitals need large urban centers that have some of the specialty care that may not be able to be offered in every community. And we need, folks to be able to find care at the right time in the right place and be able to move through their care process and back into the community. So that's kind of the background on how we get there. I think commissioners have a really unique opportunity to work with your leaders on places where you can be effective in raising issues with lawmakers, because you have something in common with them in that you are publicly elected officials just like they are. So sometimes that gives a little different angle on the relationship when you bring issues that are impacting your hospital before them. So if you have any questions at any point in this presentation, please do feel free to jump in too. If we could go to the next slide. Just want to give you a little context for where we've been this last year. So the Washington State Washington State Legislature operates on a biennial calendar. And so they have a long budget writing session, which happens in odd years, and then a short session in even years. So we just got done with a short session with the state facing a significant budget deficit that ended up being larger than expected. So they usually do a supplemental budget during the short session, and they needed to find additional revenue during this session. And the governor had proposed an all cuts budget that included additional taxes on hospitals. And we already had received in the 2025 session some major cuts and some new taxes on hospitals. And some of those taxes affected all businesses, but some were directed at hospitals. Our goal for the last several years has been not to have any taxes that are specifically targeting hospitals. We know that we might get hit with some of those just from the nature of being a business. But if we could go to the next slide. We had a very successful session. I know some of you were involved in answering some of our calls to action or attended Advocacy Day with Renee down in Olympia. We defeated all of the proposed cuts from the governor, and there were no new taxes on hospitals enacted. So we felt really good about that. We know that the hospitals really delivered messages to lawmakers over the last couple of years about the challenges that we are facing and challenges that are coming both from those cuts that we took in 2025 from the state level, as well as some of the federal cuts that are coming in the next 12 months or so. We also had some great policy success. We had several WSHA member-generated ideas that became law, and I'm going to go into a little bit of detail about those. But we also, a lot of our job sometimes is stopping bad policy ideas, and we stopped a number of those. A couple I want to just share with you are one that would have, it was called the Corporate Practice of Healthcare Bill. We are in agreement with not having any corporate interest interfere with the physician relationship with their patient. However, the bill that was proposed, Senate Bill 5387, would have put incredible new restrictions on the ability of the care team to operate and would have required the physician do a lot of things that we have other folks on the care team do now. So we were successful in defeating that. There was also a bill that was well-intentioned, aimed at regulating high-risk artificial intelligence. However, it would have, it kind of didn't acknowledge what is already happening in hospitals in places where AI is supporting caregivers in doing things like dictation and things like that. So we want to make sure that the legislation doesn't hamper innovation within our healthcare system, but does provide protection. So we'll continue to work on those issues. And then finally, we also defeated a bill, House Bill 1496, that would have put a cap on medical records fees for producing medical records for third parties. This was pushed heavily by the trial bar. Patients can already get access to their medical records, and some other third-party organizations wanted to be able to get access to these medical records years and years back, and not have hospitals be able to charge for those that take a long time to produce, and might take a lot of staff time to pull out of the EMR and things like that. So we were able to defeat that, though I'm sure we will see that coming back. We do want patients to have access to those, but want hospitals to be fairly compensated when there's a lot of work, when there's big requests. And if we could go to the next one. So a special focus for us in 2026 was on issues being faced by our hospitals related to payers, insurance companies. So we've heard for a number of years that there is growing administrative burden for hospitals and payment delays from health carriers. This has largely been anecdotal. These concerns were often raised by hospital finance, contracting, and revenue cycle teams who were getting denials, repeated documentation requests. So just a lot of work to get to that payment. And again, it was anecdotal. So in the last year, we did some work to collect data and aggregate hospital claims data across Washington hospitals so we could see what were the issues that were actually trends across payers and across hospitals. The data showed us that there's about $2 billion annually in late payments where carriers were not in compliance with the prompt payment laws in Washington state. And we were able to use some of those insights to develop some proposals that would hopefully help get hospitals the funds that they were owed for services already delivered. And we were fairly successful this year. So if we could go to the next slide, please. So the first one is addressing that timely payment requirement. So this, there is a requirement for clean claims to be paid within a certain window of time, but there weren't a lot of repercussions for carriers that were not complying with this law. So the new bill was into law. It applies to health plans filed or renewed by January 1st of this coming year. And it requires that health plans pay all clean claims in 30 days. Right now it's 95% and that were required. And you can imagine that those 5% happen to be the most expensive claims often. So there are also some new requirements for unclean claims as far as the carriers communicating with hospitals and being very clear about what is needed to make those claims complete so that they can be paid. It also implements a tiered interest payment and administrative penalties for failing to meet these deadlines, which is new and we believe will be motivational. And reduces, I think this last point is really important. It reduces the time frame for carriers to request payment refunds from providers from 2 years to 1 year. So if they think they've overpaid for something, they cannot request refunds 2 years after that, that payment is made. If we could go to the next slide, please. Another related bill that we developed at the request of members was enacting some prior authorization reforms. Primarily, this addresses the use of AI in prior authorization. It requires that a physician is the final authority on denial for a claim or an authorization. And it also prohibits retrospective denials and modifications after the care has been approved and delivered. What we were hearing was that there were patients that had been approved, they went and got a service, and then they were denied for payment later, even after having that prior authorization. We were also finding folks were saying that these AI denials and denials that happened repeatedly were standing in the way of prompt and timely care delivery, and really were impacting health of patients. So this is not only a great thing for hospitals, it's a great thing for our care teams who know and love our patients and want to make sure that they get that care that they need in a timely fashion. And it is also really important for patients and families who are waiting for that care. We know that in many cases, not getting access to timely care can really lead to somebody's health declining, even if it is something that is non-emergent. If we could go to the next slide, I just have a couple more that I wanted to share. One more bill. This last bill that I'm going to share is about EMS transports. So in current law, you have to have an RN with an EMS certification to support a transport of a patient. In some cases, and in some rural areas, it is not always possible to have a trained and certified EMS person that is transporting a patient. And we want to be able to ensure that we can quickly and appropriately get patients to the level of care that they need. So this new law allows some staffing flexibility for interfacility transfers in ground ambulance, and it allows RNs that are appropriately trained but may not have an EMT certification to support the transport of a patient between hospitals. And that's only when other options aren't available. So we're excited about that flexibility. I think this came from some of our more rural hospitals. However, we've heard from some of our larger hospitals that this is going to be beneficial for them as well. Before I move on, are there any questions about any of the legislation that I talked about that passed this session?
Beth, thank you for all your work and very exciting news.
Thank you. I appreciate that. We have a big team that worked on all these issues. So if we go to the next slide, I wanted to just talk about what we were facing coming up. So 2026 is an election year, as you might have heard. We also have not only a lot of things happening in other elections at the state level, we have many retirements of lawmakers. So there are a lot of open seats, and there may be some shifts in the legislature. Many of our bills that are defeated, this is something I've experienced for 18 years, they will come back. They are never dead. They might be dead for this session, but they'll be raised again. So we'll be looking for people to weigh in on those same bills again. And then 2027 is our biennial budget writing year. So depending on how things are looking financially for the state, they may be looking for more opportunities to cut costs and increase revenue. And we may not be in a situation where we can ask for additional funding, or the funding asked will be very limited. If we could go to the next slide, please. So if you've been around WSHA for any length of time, you have probably heard about our Political Action Committee, the Hospitals for a Healthy Future PAC. This is one of the ways that we advocate for hospitals. So political action committees in Washington State are regulated by the Washington State Public Disclosure Commission. They oversee the reporting of our funds raised, our contributions, and our expenditures. There are limits on donation amounts to individual candidates, and there are fines for noncompliance. We do split our contributions with the American Hospital Association PAC to also fund candidates at the federal level, and we have federal regulations that we follow. And then political activity is on personal time for both public hospital district folks, but also for nonprofit folks. So we use personal contact information for all of our political action committee work. So we just kicked off our campaign for the AHA PAC split. We 40% of under every contribution up to $600 goes to the federal races. So that's how we support our federal lawmakers. And if we could go to the next one, well, I'll get into a little bit about the PAC as it works in Washington State. So the reason we have a PAC is to build bipartisan relationships. We are a bipartisan PAC. We give to Republicans, Democrats, and independents, we give to folks who are champions for healthcare. And this is a way for us to unify hospitals' political voice. So we do give to individual candidates who either have supported healthcare policies that we think are good policy, or to leadership funds. We actually do a lot of giving to both the Republican and Democratic leadership funds, and they are able to direct that to candidates that they would like to see elected. If you could go to the next one. So the ways that we support advocacy through the PAC is both that election of champions, but also if we have folks that have been champions for us, the PAC helps us gain access to lawmakers. It is a way to help build relationships. They appreciate when they're supported, and it is a way that, you know, if you have donated to their campaign in the past, they're more likely to take a meeting with you. That does not, however, mean that they are always with us on the issues. We certainly have given to plenty of legislators who are with us on some issues and definitely not with us on some others. So the PAC is a crucial way for us to engage and influence our political system. It's a tool to ensure that we have strong healthcare champions elected. It is bipartisan, as I mentioned, and it also is also voluntary. Folks that can give to the PAC are leaders in hospitals, the leadership level and manager level, and also commissioners also give to PACs as individuals. But as I mentioned, there are for-profit corporations can give to PACs as a corporation. Nonprofits and government entities cannot. So it is our PAC is largely funded by individuals making a decision to participate. If you could go to the next slide. And we are delighted that historically individuals from Snoqualmie Valley Health have participated in our PAC fundraising in the past. Every year we do set a goal of the percentage out of our larger goal that we hope members from various hospitals will join us in. And then we do have a breakdown there from our PAC manager about the percent of the board from Snoqualmie Valley Health that has contributed to the PAC in the past. And if we could
Beth,
go,
if
oh,
you
go
wanted
ahead.
if you wanted to pause for a sec,
Sure.
We are a very high performing organization, and it kills me to see us at 40%. So if we could get a little more encouragement for that, that would be fantastic.
We would welcome more individuals from Snoqualmie Valley Health, from the leadership team and the board participating there for sure. And just to give you some context, if we could go to that next slide. This is kind of how our Hospitals for a Healthy Future PAC stacks up against nursing unions and the trial bar. These are two very powerful PACs in our state. Oops, if we could go back one, sorry. And you can see that we lag behind. We also do have a powerful voice in Olympia. And with both of these organizations, they are, these are organizations that sometimes we are aligned with, and sometimes they are bringing up ideas that we do not particularly like and don't think will move healthcare forward, or we might have a similar goal, but we think there are different ways to get there. So you can see that as far as the amount of money that we can provide to candidates and the healthcare champions that we can elect are lower than the folks at the trial bar and unions as far as their PACs are by size. And then if we could go to the next slide, which is almost my last one. So if any of you individuals are interested in learning more about the Hospitals for a Healthy Future PAC, you can either email our manager, Liz Cortez, or you can go to the website, which has more information about the PAC. There's a nice little video that just explains what the PAC does, probably in a more entertaining way than I just did, but you can learn more there. And that also would give you instructions on how to give if you so desire to do that.
Hey Beth, a quick question.
Yeah.
Several of the board members are going to be in Chelan this year, and there's usually some sort of like cool swag or incentive in Chelan. Are you
Yep.
doing that again?
Oh yeah, there will be swag for participants. There's also always a drink or a mocktail special deal at the barbecue as well. A special ticket for some kind of, fun
So
beverage.
should they give now, or do they get credit if they give now, or should they wait till Chelan meeting?
Those can be given whenever you want. Your name will be, individuals who give now will have their names already on the board when they get there, and won't be subjected to the pack pitch. You'll just be able to pick up your coffee mug or sunglasses or whatever, or water bottle, whatever they happen to have this year. I actually, Liz always surprises us with really cool stuff, and I have no idea what the swag is yet this year.
Awesome, thank you.
And then
I won't
the
be
last
there. Can I
slide is
pick
just-
it up later?
Yeah, I mean, we'll pick it up for you while we're there. How's that?
All right, thank you.
And
I'll
that's the end
remind
of my
me of-
slides.
Okay, thank you.
But we are so
And it-
delighted to have you all engaged with the Hospital Association, and really appreciate your engagement and supporting Renee and her team in the advocacy that they do on behalf of your community in Olympia and Washington, D.C.
Thank you for
Great.
joining us, Beth. Does anybody have any questions for Beth?
I like the background, Beth.
Thank you.
Yeah, that's fantastic. And again, thank you for all your work and your presentation this evening.
Great presentation, Beth. Can you tell me who the third parties are who are attempting to get information? Would that be insurance companies?
Oh, for the medical records?
Yes.
It's primarily that was a bill that was largely supported by the trial bar, actually, for lawsuit purposes. So they're looking often to get really large volumes of information, and the limitation was, I can't remember exactly what it was, but it was less than $100 for them to get what might be a large volume of materials. So it's not that they should appropriately be able to get access to those things, but hospitals also need to be compensated for the work and staff time that it takes to dig those things up. So, yeah.
Thank you.
Thank you, Beth. We appreciate all your work and effort.
Yep,
Glad
great
to be
work.
here. Thanks for the invitation. And I hope you all have a great rest of your meeting.
See you in Chelan.
Thank you.
See you in Chelan.
Okay, very good. Let's see, next on our agenda here is candidate appointment to position number
Right.
1.
Yeah, so
Re-
we have a
Renee?
vacancy in position number 1, and we have a total of 90 days to fill that. The commissioners have opened up nominations and have interviewed candidates for this position. And there are 3 candidates that are being considered tonight. And Jennifer, I believe, will help conduct the vote for this. Is that right, Skip? Or does Kevin do that?
I think Kevin, the chair, can do that.
Okay.
Your bylaws don't specifically cover it. The statute obviously does, in terms of the appointment, but I think Kevin can do that. He would open it
Skipper,
for
go ahead and do a
nominations.
roll call vote.
You can open it for nominations, and then based on a nomination and receiving a second, that person is nominated, and then you can do a roll call vote as needed.
Okay, I'll go ahead and open up the floor for nominations for filling the current open seat, position number 1. Do I have a nomination for that seat?
Can I-
President Howe, oh, go ahead, Emma.
No, go ahead. Sorry, Commissioner Carter.
Oh.
It's okay.
Okay, I was going to nominate Robert Agrisano.
Okay, thank you, Commissioner Carter. Anybody else?
You need a second for that nomination, Mr. Chairman.
I
I
will go ahead and
second.
Commissioner Herron, thank you. And let's see here. Do we have any further nominations from the floor? From the
I
board?
would also nominate Danny.
Okay. So we have 2 nominations.
You need a second for that nomination, Mr. Chairman?
Okay, is there a second from the floor for Danny?
I'll second. Carter will second, if I'm allowed to.
Sure.
Don't.
You can, of course.
Okay,
Okay, so we have a first and second for both Robert Agostino and for Danny Scott.
Correct. You have 2 nominations now, and you can take a roll call vote.
Okay. At this point, I'll go ahead and take a roll call vote. I'll start with Robert Agostino. And Emma, how you vote?
I'll vote for Robert. I know, I like I said, it was a tough choice. I also like, I'm sorry that I have to give a little spill here.
Yep.
So, but I'm
Thank you, Commissioner Herron.
Yeah, thank you.
You're welcome. Commissioner Carter.
with gratitude for Danny's candidacy, I also vote for Robert.
Thank you. And Mr. Bowers?
Thank you, sir. As I said, I was 50-50. I think both candidates would do us very well. I do sense strong support for Mr. Angrisano. So in legal terms, Mr. Hauser would be happy to say at 51% more likely than not, I would be voting for Robert.
Thank you very much. I will also go ahead and support, again, with great gratitude towards Mr. Scott and Mr. Pearlstein's interest in the position. I'll go ahead and vote for Robert Agostino, and we have a selection that has been selected. And so we'll go ahead and move. Thank you, everybody. And we'll go ahead and move forward with that. And Robert is going to fill, Agostino will fill position number 1.
So
And-
we prepared for tonight. I think I saw Robert in the chat. If Robert's still here,
He appears to be on there.
Skip is prepared to swear him in tonight.
Robert?
Yes.
Are you
Robert,
here,
if you can go and unmute
Yes.
yourself and turn your video on.
Okay.
Go to the comments. Yeah, go some.
While you are doing that, I can advise the Board of Commissioners that this appointment does take effect upon the oath being undertaken. And Robert then will be able to sign that oath and have that document notarized by the hospital district. So Robert Angrisino, if I could please have you raise your right hand, I'm going to give you the oath of office.
Okay.
I, Robert Angrisino,
I, Robert Angrisano,
having been duly appointed to the office of Commissioner for Public Hospital District Number 4, position number 1,
having been duly appointed to the office of Commissioner for Public Hospital District Number 4, Commissioner, position 1,
very well done. Do hereby solemnly swear and affirm
do hereby solemnly swear and affirm
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution and the laws of the state of Washington
and the Constitution and the laws of the state of Washington
and all local ordinances,
and all local ordinances,
and that I will faithfully
that I will faithfully
and impartially perform
and impartially perform
and discharge the duties
and discharge the duties
of the office of Public Hospital District Number 4, Commissioner, position number 1.
of the
The
say that
duties,
again?
the duties of the office of
The duties of the office of Public Hospital District Number 4, Commissioner, position number 1,
according to the law and the best of my ability.
according to the law and the best of my ability.
Congratulations on your appointment to the Commissioner position.
Thank you.
Congratulations, Roberts. Welcome.
Congratulations, Robert.
Thank you. Look
Congratulations.
forward to it.
And
We will follow
Having
up
taken
with
the
you.
oath of office, he now can participate in the meeting as a commissioner at this time.
And Robert, we will follow up with you, and Ashley will help with the notary and making sure we notify the county as well.
Okay, appreciate that. If it's all right with the board, I'm at my granddaughter's 18th birthday party. So if I could be excused to get back to that, I'd really appreciate it.
please be excused. You are.
Okay, thank you very much. And I'll follow up with you, Renee.
Thank
Thank
you,
you,
Robert.
Robert.
Thanks. Bye-bye.
Goodbye. And I thanks again, Danny Scott and Jonathan Pearlstein for their interest and their time invested in this process thus far. Thank you very much. And thank you, my colleagues. I'll go ahead and appoint the committees. And Jennifer and Renee, what I will ask is, I know last meeting, I believe we had postponed those position assignments until we had this process done. We delayed it. And so with that being said, can you confirm that that's correct?
Yep.
Yep, that's my understanding.
And
Thank you
I
very
believe
much.
the chair can make appointments at any time, so it's appropriate.
Okay, thank you. I'll go ahead and do so at this time. For the Finance Committee, I'm going to go ahead and I'm going to term it this way. I'm going to invite Jennifer Carter to fill one of those seats for the Finance Committee. Would you do so?
Yes, thank you for the opportunity.
Absolutely, thank you. And then I'll go ahead and sign Robert Agricino for that second position on the Finance Committee. Moving along to Quality Committee, Mr. Bowers, would you be so kind as to serve in the Quality Committee?
Yes, sir.
Thank you very much. Emma Heron, would you also fill a seat on the Quality Committee?
Yes.
Thank you very much, everybody. That is the assignments for this evening. I continue as the board chair to serve on the MEC committee.
Thank you all for your service. We appreciate it very much.
Absolutely, and thank you. Now we'll go on to the approval of achievement of the 2025 KPIs. Renee, would you please carry on with that? And thank you so much, and thanks for all the hard work that everyone has done.
Yes, so this is a really exciting time. As you know, we set our annual key performance indicators and we report on them every single board meeting. So these are the 2025, these are last year's, and we had reported to you earlier in the year the success on those, but per our policy, we have to wait until our audited financials are complete before we can confirm the financial trigger. And so we have reviewed with all of these with you, but tonight we're just going to go through to formally cement these for you and report on them. Jennifer has a really long document that we sent to you that is very thorough that you can read, but just in summary, we'll breeze through those. On the financial stewardship, the first target, which is the trigger, our objective was to achieve a budget with a break-even bottom line.
Renee?
So I've explained clearly in here that the intention of the board in 2024, when these metrics were chosen for 2025, that the intention was for us to achieve our budget, and our budget was set with a break-even bottom line. So we, and by the accounting standards, more than achieved that. But there was this little teeny project that we had called the Hub that we borrowed a tiny bit of money for with a bunch of zeros behind it. And with that, and these silly accounting rules called GAAP, it requires us to account for the interest of that debt all when the debt is issued. And so in other organizations, and actually previously this GAAP rule, you would have amortized that interest over the period of the life of the building. So in this case, maybe 21 years or so, or 20 years. So what we have done here is we've showed what we call a waterfall, which removes the variance of the cost of the debt issuance. And what you can see as a result of the bottom line here is $3.1 million positive bottom line. And more importantly, and something for the board to really watch, I like to watch the operating income because that tells you how efficiently your organization is running without the taxes and all of the other things that come in below that. So even if we were thinking, how did we perform throughout the year operating wise with the operations, we still achieved $500,000 in operating income, which is incredibly significant. So this team more than exceeded the board's expectation and the challenge that the board put out for them. And we are showing here just removing the issuance cost so that it doesn't falsely look like the team did not achieve its goal. And Patrick, I would love to invite you to add any commentary or to entertain any questions.
Yeah. I'm happy to do that. I would also remind the board that 2025 budget, the operating income that was budgeted for 2025 was actually $43,000. You can see we got 10 times the operating income for that at 557,000 of operating income. So we exceeded the operating income budget by a significant portion there. Again, like CEO Jensen said, due to the accounting rules, GASB requirement that we take the issuance costs in the year when you receive the funds. That's what led to the change in that position being negative. But as you can see that when you remove that, it is $3.16 million that we actually earned in positive net revenue for 2025 outside of those issuance costs, which it's an accounting that we have to term. It is not due to any lack of operations or anything related to that. Any questions regarding that?
Thank you both for the explanation to bring some clarity to it and the great effort.
Yep. So if there's any questions, we'd love to entertain them. And we will plan to have the board vote on these KPIs at the end of our presentation here. So any further questions for Patrick on the financial trigger?
Yeah, I know this may not, but I think it's still related. In the past, in the financial packet that we always receive, is several copies of a general ledger with check disbursements to see who because what I noticed right now, we have a new CPA and it's not Moss Adams. So in order for me to understand, you know, who are we paying all this, we need to have that again back into our packet. I appreciate that.
We do have that. It's in the packet that's included in there. You can see the check register on there. And Moss Adams was acquired by Baker Tilly. So it is the same accounting firm that we've had. Okay. Baker Tilly acquired Moss Adams in mid 2025. Actually, last year, June is when they were acquired by that. So it is the same accounting team that we work with. They were just acquired. They merged with Baker Tilly, and they took on the name Baker Tilly when they merged with them.
So, Patrick, but I don't see exactly those that I am referring to, because I asked Kevin earlier today as well.
Patrick, thank you very much for that explanation. I think I can clarify.
We will resend the check register to you, Emma.
Yeah,
we can do that.
We will resend the check register to you.
Yeah, thank you.
It looks different than it did in the past, Emma, so that may be it. But we can send that to you.
Yeah, thank you. It'll be we have to do our due diligence as well. So because there's so many changes that sometimes.
And Emma, remember that the finance committee is in charge of reviewing those, and those are presented and questions are answered during the finance committee as well. And so your commissioners that are appointed to that can also help answer questions for you.
Yeah, but we are it's hard to ask questions when you don't see the numbers and the vendors or the contractors. It's really hard to. I mean, it's important that we see, you know, where it's going, where our you know, payments are going to, who are we paying and whatever. I know, otherwise I would be able to participate because I don't have a figure or number or name. So I think it's important that we have that. Thank you.
Yeah. Yep. It'll be coming. Thank you.
All right. Thank you.
Everybody. Yep.
All right, let's move on to the next one if there's no more questions on the financial trigger. So we are marking that as achieved.
Thank you and congratulations.
Thank you. That's a phenomenal amount of work for the entire organization. Everybody contributes to that. It's absolutely amazing. Foundational elements. This was opening our North Bend clinic. We did that. It has been a huge success. We have seen thousands of patients and we have 2 full-time providers, and I won't give away too much, but we have a 3rd one coming for North Bend. So that one, not easy and a lot of work and a huge team effort, and we are marking that one achieved as well. Next one, Jen. Our 3rd one is our team. One of my favorites because it focuses on our staff. Oh, did we skip one, Jen? If not, we'll go to this one. Health system of choice and likelihood to recommend. We heard from Director Rudberg about this last month on just how amazing those patient satisfaction scores are, and we have definitely maintained that top box above, well above 90%, and finishing out the year at 93.4. So that one is achieved as well. And now our team, our staff, the next one. Thank you, Jen. And this one is our first year turnover rate. This one we struggled with, and we were bumping along there and even exceeding 32. And we remarkably finished out the year at 24%. And we are really starting to feel that in our culture here. And we're learning how to hire the right people that fit our core values. And our team has done a lot of work with retention, and that it's taken a while for that to really kind of catch on, but it's done a great job, and we're starting to see the benefits of that hard work. So we are marking this one achieved as well. And last one, Jen. Or maybe a lost count. Oh, health needs assessment. There we go. Community health needs. So this is a volume metric and increase. We're measuring the number of outpatient visits. And the reason that we have a community health needs, or we're using a volume metric to measure it, is because the number of encounters and numbers of times that we can touch somebody's life and provide care and support for them means we're making an impact in the health needs of our community, and we're providing the services that they need because they're using us. So we had what we felt was extremely challenging 1% increase, because we had increased so dramatically the year before. And we actually, at the beginning of the year, were a little bit worried about this one, but we actually were very successful and exceeded that goal with approximately 61,000 visits from our outpatient services. So that's an amazing number of times that we've gotten to be able to support our community. So I won't bore you tonight at the board meeting in the interest of time, but you have this document to read in depth. It's the same information we've been providing, just this is the formal adoption and approval by the board, which then will allow us to do the strategic plan incentive payments for all of our staff. And for Mark, you are new, but this is really rare in an organization like ours. But our incentive program is for everybody. And so everybody in the organization benefits. Everybody has the same goals. We don't set different goals and different metrics for different people, but we all say we are all in together, we all win together, or we all lose together. And in this case, congratulations to the staff and the team for their hard work, because they have achieved all 5 of these goals. So we're extremely excited, and even our part-time staff to full-time to managers, directors, everybody benefits, and it's amazing to be able to send those checks out and paychecks, even though Patrick, I'm sorry for the payroll addition.
I'll get you back another way.
Happy to answer any questions, and if there are none, then Kevin, we will take a vote for approval.
I will, before I call for the vote, I just want to say this is one of those absolutely feel good things, and well deserved, and took a lot of work. Everybody works together, as you said, Renee, and everybody gets it or everybody loses it, or does not get it. And so it is just an honor to be able to make this happen. So with that being said, I'm going to go ahead and call for approval of the achievement of our 2025 KPIs. Do I have a motion to approve that?
So moved.
Thank you, Commissioner Bowers. Do I have a second?
Second.
Thank you, Commissioner Carter. Hearing a motion that's been made and seconded, the call for the vote. All those in favor of the motion that has been made and seconded, please signify by saying aye.
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 Aye. Opposed? And no abstentions. Motion carries. Thank you very much, everybody. And congratulations, Renee, to you and your team.
Thank you to the boards for supporting this program. It really means a lot to us, and it means that every single person in our organization understands the strategic plan and how they make a difference and how they can help impact that in our community. So thank you.
You
I just
bet.
comment
Thank you.
that I think those are difficult KPIs to meet. Probably any hospital in this region would be very happy with the success that you've had. And I hope that the employees feel very well rewarded.
It's a wonderful team, and we're really happy to be able to do it. So thank you. All right,
Thank
Commissioner
you.
Hugler, you want me to
Commissioner
roll
Barnes?
into the CEO report?
Yep, let's do it.
Okay. All right. First, I am really, really excited, and I am so excited that I'm going to have Tammy do this part of the report, but I want her to give you an update on what we are doing with provider recruitment, and we have some great news for you.
Hey,
We do have some great news for you, and CEO Jensen gave a little bit of it and let the cat out of the bag, just a tiny bit, but yes, it is a collective effort, and I will tell you why. I have had the most joy in getting close to our existing providers, but also getting to talk to all of the providers who want to come work with us. And I've shared some of that with you over the past several months because they are just falling from the sky in terms of number of providers who've heard about what we're doing and want to come work with us. But when they come on site, they don't just meet the executive team, they meet our leadership team, they meet fellow providers, and they're doing all the work for us. They are recruiting these providers, physicians alike and APP partners, and telling them the real truth in front of me and others about what it is like to work here. And it's all very positive. So with great joy, we are going to bring on a doctor. Well, I'm going to hold. I'm not going to give his name yet. Teasing with that, but this is a DNP candidate, nurse practitioner who is an experienced family practice provider who's been working at a major system in another part of the county, I will say that, but is a local resident. So he also is tied to this area. He is thrilled to be here. In fact, he might even be walking distance from the new facility going up. So super excited to have him join us in August. If I can get all of the ducks in a row, which is why I won't give you his name yet, but I promise I will next time. So in addition to that, we have a couple key players, and a shout out to CFO Ritter, helping me through the contracting and determination with the rest of the exec team, how we get these providers to join us from a compensation perspective and strategic perspective. But we have an offer ready to go out to dermatologist out of Central Illinois, Indiana. Forgive me, I don't know states that aren't surrounded by oceans. So she's somewhere back there, but she is a lovely human being, and I can't wait to have her join the team. And she has already verbally accepted. She is thrilled to join us. So the rest are just a few contractual details. I am convinced we'll get there. So that is number 2. We have another offer ready to go out to urology. So we've been talking about that. Sometimes these are slow to roll. You've got to get really all of your details in place, make it the right fit. So we're working on urology. I'm hoping to have that locked down. We had one family practice interview this week, and we have one to follow next week. Both extremely strong, experienced candidates, one of whom lives, again, locally in our community. So trust me, I'm asking, why haven't you applied before? Which Nicole Pass is extremely excited about every time from a marketing perspective. I asked that question and they said, well, it's the building going up. I couldn't help myself but see it. So that billboard behind CEO Jensen in her screenshot there, that is doing exactly what we thought it might do, which is making people curious about what we're up to. So good news on all fronts. We also have an interventional radiologist. I've talked about her before, and others who we are looking at and as far as their application. And yes, Nicole put in the comment, Hub is the best advertisement. I would argue the best advertisement is your experience when you come see our care teams. The Hub will be number 2. But yes, Nicole, we'll arm wrestle over that later.
Tammy, thank you for all of your partnership and help with this. It's been a team effort across the executive team and the medical staff to recruit just the right providers too. We've been really picky about who we're choosing and staying true to our feasibility study and making sure we're getting just the right specialties as well.
Absolutely.
So thank you. And I can't wait for derm. And this dermatologist is like, you guys are just going to be so excited. She is amazing. So.
Renee, can I share just one small detail? I won't take time. So dermatology, I have to share. I was doing a screening call with her, and CEO Jensen wandered into my office with lunch for me because she knew I hadn't eaten that day. And this is what she does for all of us as leadership. And so while she was there, I was like, say hi to the dermatologist, tell her how amazing it is. So she got to actually see her and experience that as well, but it was too good to pass up.
Yeah, definitely a team effort around here. So thank you. We'll keep you guys posted on when they start and kind of new specialties and things we have that you can tell your friends about.
Good
So
job
thanks, Tammy.
capturing the moment.
Can I ask a question?
Yeah.
it's really exciting to hear all this new physicians that's coming and going to help you with the success of our story. And pretty high level executive, sounds like it. Just curious though, in terms of compensating, how do you entice them to come? Where do we get the process of giving them whatever it is that they are looking for in terms of compensation? Is it
That's a
on a
really-
budget?
That's a
Yeah.
really good question, Emma. And it's kind of it's actually a very strategic question in one way. So essentially, there are many different tools and resources that tell us how, like MGMA is one that you may have heard of, that tells you what the average compensation is for that specialty and how many patients and how many RVUs they should see and generate to be able to make that amount of money. And so it's actually more scientific than you might think. It's a very data-driven process, and then it's just kind of a negotiation based on what do we want to guarantee for their base, and then how much would they earn based on their productivity and the dollars of the revenue that they would bring in. So that's essentially how we do that. But your other question that was kind of buried in there that was a really good one was, well, we don't have the hub open yet. How do you pay for these people when their practices aren't full and they're not, seeing enough patients yet? And we have all these specialists, and what we do is we call that a ramp. And so that means we anticipate they're going to see fewer patients when they start and more patients over time. It's scary, and it is. I mean, when we are making payments on the hub that you see behind me, that's not generating revenue, but we're hiring physicians and paying them, and they don't have full panels yet. It's scary. We have to cash flow that. We make those assumptions in our feasibility study that we know that we're going to be putting in a financial investment in these physicians until they start seeing the full patient panel, and we. So we count on it. We are strategic about it. We know what's happening. We have to generate more revenue in other areas like radiology and ED to be able to pay those salaries while those people are getting up to speed. And then our CFO lays awake at night and worries about it. So,
Yeah.
So
it is
Patrick keeps an
difficult
eye
to
on.
fathom to give a lot and we're going to be receiving less because we're a nonprofit. I thought, but yeah, again, I understand. It's a pretty scary. We'll wait till
It is.
everything is in place.
Yes. And it takes a village. I mean, Director Pand is working really hard on making sure the appointments are full and there's room to see the patients, and our referral teams making sure people are not waiting in line to get in to see these patients. It's a lot, and it's nerve-wracking at times, and there is a lot of pressure on this team to perform and be able to bring these providers on. So it was a really good question.
Renee, I would add to that. Emma, if we go back to when the bonds were sold, and we back up further, say 18 months, or possibly even further back than that, as you know, we go through our needs assessment. We go through a lot of forecasting. We are always very conservative in that process. And we also, when we sold the bonds, we anticipated cash flow needs, and that was built into all of that as well. So this is all very, very strategic. And yes, that being said, it is nerve-wracking, and I'm sure Patrick does lay awake at night sometimes, as I do as well sometimes, and I'm sure everybody does. But I tell you, this
That's
is
not
not
the
by
reason I lay
accident.
awake at night, so
Yeah.
it's okay.
This is not by accident.
Awake
where
at
we're
night,
at.
but creative mind is working.
Yes, absolutely.
Yeah,
and
I think the
it's very
challenge, Commissioner
methodical.
Hughley, is that we're making these assumptions and predictions to the best of the knowledge we have 18 months ago, or 24 months ago, or whatever, and things change, and we do our best that we can, and then we have to just understand that that's where we are, and we have to navigate and manage to that. And so in this case, we got the shovel in the ground about 3 months later than we had originally predicted, and so that extra cash that Patrick had borrowed just in case is coming in handy, because we're going to need it, because it's going to take us 3 more months than we had originally hoped to get moving. But another example is the ramp on some of our specialists has been slower. than we had predicted. And I think we underestimated how difficult it was to get patients out of the other market because it's so carefully guarded by other entities. However, one of our specialists today had 17 patients. I'm like, God, he sees 17 patients in a day right now. So that's it's tremendous. So it's happening, and it will happen, and they will be full. It's just a little slower than we expected. So we're having to make sure that we're really good citizens and seeing additional volumes in other areas.
Yeah. And I think we're witnessing that success breeds success. When Tammy talks about the recruitment aspect of what's going on, and the tremendous success, yes, we have a billboard, but we have a team that has a great story. When they sit in front of this team, you can't help but heed the success that we're having and how we arrived at it. I mean, it's extremely methodical and strategic in the way that it is executed. And but Emma, thank you. You couldn't have asked a better question.
And I think Dr. Moore would also agree that generally speaking, the people that we're attracting are driven. They're not going to be happy sitting on the sidelines making a big check for nothing.
Mm-hmm.
No, yep. part of our screening process.
Yep. Good job.
I won't go through all the detail of the community outreach, but oh my gosh, we are busy. I am exhausted. That team is running me ragged. And yeah, Kelly Bender is awesome. She's getting our providers out there. She's going to the sorry. We're just having a overhead call here at the hospital. So we are getting Dr. Wallace out to do high school presentations. We're doing job fairs. We are just like everywhere. It's been fantastic. So I encourage you to read all the hard work that they've been doing in there. Also at the end of the CEO report, reminder that we always put the dates of the upcoming community events and the engagement that we are doing. So we encourage you to attend those and come be beside us when we do those. I want to shout out under Health System of Choice about the medication safety awareness campaign that's happening. And Trish, I don't know, you probably don't have your badge of Pilbert and Poppy there. I know. But we have a couple little mascots that Director Corey has brought to us, and she's doing a really good job making medication safety fun and working really hard with our quality team on reducing medication errors and near misses. And so there's lots of activity going on with that, and just a shout out to Corey for making something that could be incredibly punitive and boring fun. So thank you. Oh, Neil, are you putting it in the chat for us there? We are on track with our MRI project, thanks to Steve Bradshaw and his team. Calling out to you, just so you know, mark your calendar, save the date, a ribbon cutting ceremony for the new MRIs on June 24th at 5 p.m. It is scheduled. So that means everything has to go good between now and then, Bradshaw. No slacking off. Ribbon cutting is set. So we're really excited about that. It's been a long time coming and a long road to hoe to get here. Another shout out about our people. We've heard a lot about how much amazing nursing staff and others that we have, but we twice a year we award a Daisy Award, and so this is a nurse that is nominated by a patient for their outstanding service to their patients. And this time we recognize Christine. Or we call her Chris Puscalone. You might recognize that last name. She's an outstanding nurse in our emergency department, and it was just amazing to get to honor her. And I believe that we told her patient story last month at the board meeting about how she made sure that a patient had shoes, and a shower. So it was fantastic.
Great story.
Yeah, and great to honor Chris. She's so deserving. Also, we've got Corey all over in the news in my CEO report tonight. I also want to shout out to her because not only does she do good work here, as many of our directors and managers do, but it's also important that they're participating outside of the walls of our building. And so Corey has been very engaged with the Washington State Hospital Association, helping with a opioid tapering guidance resource project. And then also reaching out a statewide clinical advisory council supporting more development of new opioid prescribing and quality methodologies. Lots of words there, but you heard Robert mention the opioid crisis earlier, and some of this work that Corey is doing is a reflection of that crisis and the need for the support for this. So shout out to Corey for representing SPH and her great clinical expertise. Hub construction update. If you haven't been to campus, you should. The siding is going up. And so it's cool that you can, on the hospital side, you can start to see what the actual facade is going to look like. It's fun to see it not look like a pink Pepto-Bismol building anymore. And the curbs are going in. So the permanent curbing, you can see they're great, big, huge, tall curbs. Eventually the asphalts that's there now will have another layer on top of it and make those curbs not look so big. We're moving some fencing this week into the driveway so that we can get more of those curves in. And we are just moving along. We were able to do a hard hat tour and both Kevin and Emma joined us on that. We will have more. There will be more opportunities. And it was fun to get to show the both of you the kind of the inside and yeah, thanks, Dan. It's a whole new world in there when you go from paper to actually like seeing the beams and the concrete and all of the electrical things everywhere and the HVAC. And so it was fun to be able to share that with you and have that hub project really feel like reality. And so I think we're going to have another one for another donor and foundation board tour in about 2 weeks. As soon as we pick the date, I'll let you know so you can join us if you'd like. Those generally occur, I'm sorry we can't be super flexible on the time, but generally occur around 3:30 in the afternoon because that's when the trades are done. Earlier this week, we had to do I called a field trip with Chef Blake out to kind of check out some things in the restaurant area. And oh my gosh, it was chaos. We were there at 10 o'clock in the morning and literally you almost take your life in your own hands because there are people with nail guns and beams and cutters and welders and you name it. It's like things are flying. So we will protect your safety, and those walkthroughs will be at 3:30 or 4 o'clock in the afternoon. But we'll let you know as soon as they're scheduled. And then the last thing I wanted to share tonight was that our hub was featured at the Architects for Health Communities. So that's a mouthful, but basically there's a local architectural group in Washington State, kind of statewide, like our WISHA, but for architects. And they have a twice-a-year annual conference, and they invited us to come, and I was able to speak alongside the architects about the hub project. And it was pretty fun because I don't know if you've ever been in a room with a bunch of architects. It's different than being with healthcare providers. And it was weird to be like the only CEO there. They kind of make fun of us and tell stories about us. And so it was fun to like be there and hear how they talk about us behind our backs. But it was great. It was so fun that when you get deep in these projects and you have this vision and you have a team that aligns and you all know where you're going, it was just to pause and like understand that it's not normal. Like when we presented this project and the feedback that we got, people were in awe at the work that we were doing and that the way the project was coming together, the way that it was an ecosystem being integrated, and how we were using creativity around retail and healthcare, as well as textures and colors and non-traditional healthcare elements. It really is something special, and I don't think you fully realize it when you live and breathe this every day. So it was really amazing for me to get to go and present our project and interact with a different profession. So thank you for the opportunity to do that. And we will continue to do more presentations of our hub and our projects so that we can help influence healthcare of the future in other communities. So with that, I'll entertain any questions you might have about anything in the report or anything else you might want to know more about.
I know Emma and I were absolutely in awe or impressed with the hub and all the details that we're able to see and the explanation. It's you live, eat, and breathe that every day. I know Renee and so many of you, and to experience the intimate awareness of every corner you turned around was just it was awesome. It was awesome. I thoroughly enjoyed it and would certainly welcome others that have an interest in attending that.
Yeah, I think we should all take a tour. And Renee, you make a super tour guide. She knows everything, every description, every layout, every inch and squares of it. That was really great. It's amazing how much you have that in your computer head.
Yeah,
I was impressed. Thank you.
Yeah, I mean it's like knowing your child. You know every square inch.
Yeah, and I did gave I went home and forgot to return the goggles or whatever you call it. And I gave it back to the gentleman that wasn't. I said, make sure Renee gets this. You will be really safe. You will be appropriately clothed.
Thanks,
So
Emma.
anyway, thank you.
You bet. Yeah, it's hard to do tours right now. I know everyone's interested, and we've been doing some tours for some of the managers that need to check things in their areas to make sure they're appropriate. But just tours for fun are really hard. We have to ask the GLY team to work overtime to do that because we're keeping them after their hours. But we're trying to get as many in as we can and give as many people the opportunity to see it while it's still in its raw state, because it's really fun to then see the finished product later. So more
And
to
I have to
come.
give kudos to, and I hope this is appropriate, Renee, but I have to give kudos to, I think Danny Scott played a role in the recruitment of his replacement.
He did. Yes.
Okay.
Yes.
And I had a chance
shout
to
out-
meet him on the
Excellent.
tour, and
Yeah,
this
Neil.
gentleman has worked with GLY and the staff of GLY for over 10 years, I think I heard. So he knows these people. He's worked hand in glove with these guys for 10 years on the Overlake project. So what a cohesive situation we have. It's fantastic.
Yes, at the beginning of the board meeting, while we were waiting for others to join, Neil got an opportunity to introduce himself. He's with us tonight. We're excited to have him. He's got a great knowledge, and we couldn't be more thankful for Danny for helping recruit him.
Yeah. Thanks, Neil.
Yeah. All right, moving on to the dashboard so we can keep the meeting moving. Foundational elements, you heard Tammy's report tonight. So we have 3 of those 5 providers hired. I anticipate that we will exceed this goal. So shout out to Tammy for the help with that. We are doing well and on track with our community health needs. And again, this is a 1% increase this year as well. And financial stewardship, that's looking ugly. You'll hear about that in the finance report. I won't belabor that anymore. Patrick can share with you. Health system of choice, continue to have great scores there, no concerns. And then I am really impressed that our first year turnover, our average turnover rate has continued to stay below what it was in previous years, below that 31%. So we're looking good. And this is your 2026 dashboard.
Thank you.
So a reminder that the one thing that is different this year is that financial stewardship goal is generally a trigger for the rest of the metrics. This year, because of the volatility of the financial situation with the hub, the board had voted to not make it a trigger. So in fact, each of these 5 key KPIs are their own individual KPI, and there is no trigger. So for instance, if we weren't to meet financial trigger for some reason, not only would our CFO not sleep very much, but we would have, if we achieved the others, we would have 4 out of 5. And unlike previous years, that's a little bit different. But this team does not like to fail. And so we are holding out hope that we can improve that financial goal before the year end. So, all right,
Thank
that's
you.
what I have for you.
Thank you, Renee.
You bet.
Okay, Patrick, with our finance committee report.
Yeah, thanks for saving the good news for me. As we get into the CFO report here. The first thing I wanted to talk about is, it's mentioned earlier, we did receive our financial audit complete. It was completed by Baker Tilly. You'll recognize Matt's name on there from Moss Adams when they were called Moss Adams, but same team there. If you go on to the next slide there, the auditor's report is an unmodified opinion. That is the highest opinion that you can get from an auditor. So that means that the financial statements are fair and everything was done according to GAAP. And so that is a clean audit. It is a good audit. It is what you want to see from a governance perspective, that your finance team is doing what they need to do to be good stewards of the funds of the district there. Again, there were no issues, no internal deficiencies, and the accounting estimates are reasonable. Moving on to the next page, you can see the trends there. Where we were, 2024 is the green, 2025 is the gray there, and I'm sorry, 2024. Those are 4 years there. The assets are green, the liabilities are, I was skipping to the next one, sorry about that. But you can see we had quite a bit of increase in our assets over last year, over $150 million, and that was due to the bond issuance that we had in October of 2025. Taking a look at the next slide, you can see our cash and investments quite a bit higher than it was, as well as our patient AR had gone down, which is good. Our capitalized assets increased due to what we've put into the hub and the other projects that the hospital had. And then again, we had some other outflows there due to what we've been in our investments for 2025. So liabilities, you can see our liabilities increased quite a bit. That's the investment for the hub. That's the $235 million that we had that retired some of those 2015 revenue bonds as well as the new 2025 revenue bonds. And the good news is our net position continued to increase as it has over the past 5 years there. So strong net position growth over the past 5 years, and a good, our debt is related to investment in capital. And so that's how you want to use your debt. The debt isn't being used to pay for operations. It's being used to invest in new service lines. So taking a look at our days cash, you can see for 2025, including everything we borrow, we had 981 days cash on hand, which is about 3 years worth of cash. Now we know that was at the end of 2025. We're going to expend that in 2026 with the new building. But you can see how we compare to other CAUs and the US. The US data is 2024 and the CAU data is 2024 because that's the last reported audited financials from those there. So a strong cash position, you can see where we are, minus the revenue bond funds, we'd still be over that 122-day mark. We'd be right around there. So in line with our peers and better than US. And then you can see where we are in our days in accounts receivable. Much better than our peers, about 6 days, slightly above the US national. So a strong AR. You can see where we gone down from 2022. If you remember, that's when we went live with Epic. Took us a couple of years to get through that, and we are now have the AR days under control there. And just a reminder, the AR days is the number of days it takes us to get paid for when we provide services on average. And so this is, go ahead.
Patrick, is Washington CAH, is that all the public hospital districts or just us?
All the critical access hospitals. So I believe there's 1 or 2 public hospitals that aren't critical access hospitals, but the overwhelming majority of critical access hospitals are part of a public hospital district in Washington.
Okay.
Great question. And you can see our even better is our gross days in accounts receivable, where so that's when you remove all the net and all the credits and everything like that. You can see that we are actually doing much better than the WA and the US. So it is a good position to be in as far as days in accounts receivable for 2025.
We talk a lot about that in the finance committee, and Patrick, congratulations for you and the team. And I know we beat on you pretty hard on
Yeah.
that one. And
Yeah, well,
you're doing a great
there's
job. Thank
there's
you.
good and bad with AR, right? Like,
Yeah.
so you want to make sure that your AR days are low, but you also want to make sure that you're not having to have too many write-offs to get your AR low. So that's where we'll talk about that a little bit later when we get down to the April financials. That operating revenues and expenses, you can see how we've grown over the past 5 years. We were at 43 million just 4 years ago. We're up to almost 60 million in operating revenues and on our revenues. And you can see our revenues have been better than expenses, a little bit under in 2021, but and a little bit over in 2022. So good growth in revenue, good control of expenses. That's why we've had operating incomes for the past 3-4 years. A good position, good strong growth. It's rare to have good operating in healthcare income. A lot of the income usually on the bottom line is derived from investments that the big systems have available for that. Operations, you're hoping to break even, and therefore that you can well do better than break even, but generally that's what we're seeing from most hospitals in the area.
Is this year to date?
Emma, these are the 2025 audited
Oh, I'm sorry.
financials.
Where
Yep.
do you see us from last year to this year to
So
this
if
month?
if you look there, this is all us. So this is 2021 is on the far left, and 2025 is on the far right
Yes,
of the screen.
I see.
So
Okay.
so
Yeah,
this is our revenue and our expenses. So the
Very good.
revenue is the green line and expenses are the gray.
Okay. Yes, thank
Patrick,
you.
can you
Yeah.
add a comment relative to the current trend from January to now?
Yeah, it looks a lot more expenses and a lot less negative. That's my comment that we'll talk about that but that's due to investment, right? That is a theme you're going to hear probably over the next couple of years as we ramp up the hub, right? Our ROI doesn't expect to turn positive until late in 2029. And so we're going to have a couple of tight years in that regards when you're taking a look at your bottom line, but there should be a trend growth towards that, and moving forward beyond 2029, there is real positive growth that's going to happen as the facility should be full up there. It takes 2 full years for any service line to really get up and going. And part of the reason why we hired earlier is to try to lessen that amount of time in the new building for that to happen, so that at least we have a good base going into the hub with those specialty providers. And it's actually like a proof of concept as well, right? Well, when we did our roadshow with the investors, it was we're gonna add specialty services because the data out there shows that they're underserved in these areas here. Well, if you build it, they will come. Doesn't sell very many bonds. So you had to have a strategy in there that would show, okay, will you actually bring on these service lines? Will you actually see the volume that you need to do that? So as Renee mentioned earlier, we're a little bit behind of what we estimated at the time, which was a good conservative guess. But we are showing that growth, and it is growing every month in all of those areas. And we had a really good roundtable today when we talk about financial acumen and just all of the ways that the operators are really thinking critically about how we can enable our patients to get greater access, to get faster access, to be able to really ramp up these providers, as Mark said, so that when they're earning their paychecks, that they're seeing patients, and we they are all behind that too. These providers, they're making tweaks to the way that they typically accept referrals and things like that. So the team is really really thinking critically on about how we can do all these things in a way that's going to maximize volume for when the hub opens.
I'm confident.
Oh,
If
good.
you have your crystal ball, how do
Oh,
you
yeah.
forecast when we have maximized our potential? What year 1, year 2 after the hub is
It-
going to open? That
Yeah,
we
it's
reach
going to
1
be
million.
year 4, Emma, after
Year
the
4.
hub is open. Yeah, 2031 is going to be a really, really good year.
The
So,
million mark.
yeah, and it should, based on the projections there. It
Mhm.
will, yeah. I
Okay.
will have a good day if 2031 turns out the way that we project. So it's I mean this is an investment. So and the board support is been really critical with that, and you all have bought into the vision and are excited just as we are to that. So yeah, I can't say much more.
Yeah, very good. Thank you.
Yeah. Next slide, please. So our expenses as a percentage of operating revenue, you can see wages and benefits, we're up at about 56% there. That is very typical for hospital systems. We are a service industry. Wages and labor is going to be our biggest expense. We also have highly skilled, highly paid labor in healthcare, and so therefore you are also going to have a higher percentage than you will in some other service areas. And we've made an investment in our team. We've increased the benefits. We've done the things that make this the great place to work that it does. And you heard about providers knocking down the door wanting to come, you know, and even specialties that we wouldn't even think about, are excited and what we're doing here. So taking a look at our pro fees here, this is one big turnaround, Commissioner Herron and Commissioner Haugley, that we're always taking a look at. You can see that is reduced in 2025, and that trend does continue in 2026. We are continuing to reduce our contract labor and bring more of that staff as permanent hires there. And our purchase services, about 10% is what you typically see. Next slide. So we've talked about expenses. Let's go ahead. And income for debt service. You can see our requirement in 2025 was our income for debt service was $499,000. We had $4.9 million available for debt service. So we had 10 times coverage for debt service in 2025. So that is a very good stat. These are some of the comparisons between SVH and national. You can see Washington, most hospitals had negative margins, operating margin. We had about 1%, just under 1%. National, we're about 2%. And that 0.9%, a lot of it had to do with investments that we had in the extra expenses for hiring on those providers at the end of the year and things like that. But our total margin was negative due to that cost issuance we talked about earlier. Our outpatient to total revenue is about 63%. That's grown from about 20% about 5-6 years ago. So that's the direction we're going. That's where healthcare is pushed towards. Much more outpatient, less inpatient. That will enable us when we eventually move away from being a CAW to being a PPS hospital, because we're seeing billions of patients and needing to admit all those patients. Having that outpatient services trend will continue to support that as we grow with the community. So a great number to see there. When the hub opens, you'll see that get us close to that 85% in 2031. That's what, if not over that. So that'll be good. National hospital trends, you can see excess margin. We're at about 1.5%. You can see COVID 2021 was about 6%. That's when everybody got all the COVID funds with that there. But you can see it's actually been steadily decreasing since 2020, 2016. Hospitals are having to do more things in order to have higher expenses and are getting less than we have ever before, and that continues to be a trend that we see. Days in accounts receivable, we've talked about that. I think everything else in the packet there, if you have questions, I'm happy to answer any of them. And we can move on down to, yeah. So I was kind of curious. I wanted to take a look back and take a long-term growth of where we've been over the past 10 years since we've been in the new hospital. You can see in 2015 we had 29 million in operating revenue. We have 60 million in operating in 2025. So we've doubled the operating revenue in 10 years. That shows 105% growth in our net revenue. It's 8% growth a year, which is a very strong growth. We have to take the long-term view of these things. That's why it's really important. You're building up the services for the community, and we are successful in doing that. Not only are we stronger financially, we're stronger with more services, and we've taken the money that we've made in this net operating revenue. We've actually invested it, continue to provide even more services to the patient. So that's triply strong growth. Which is not easy to do for a critical access hospital or frankly any hospital to be able to see those kind of turnarounds in there. So I always want to take a look at the long picture versus that short month to month. We can get kind of tunnel vision in that way and seeing, I know it was a big deal when the board first wanted the new hospital, but that was an investment that you can see paid off, and we will see that in 10 years when the hub as well. So
Patrick, I particularly appreciate this, and in your words, you put it in perspective. It's really good to have the reflection of where we were and where we are, and also with the diligent planning and strategic planning, financial planning, every aspect of it, and where we will be in the next 10 years. So
yeah,
I don't see this page.
Producing this.
Sorry.
This page was not included in the packet, Emma.
Okay.
I added this just really late today. I'm sorry, but I will get you a copy of
Yeah,
this.
because that's
Yeah.
very nice transformation.
Yeah,
Thank
I
you.
think it's a good story for you all to tell the
Mhm.
community too. I mean, you get asked these questions. Why are you building
Yes.
these buildings? Why are you doing this? You can see, oh, that hospital was a bad idea, right? Like we've heard things like that before in the past, but you can see what that growth has done. And not only of that, we've tripled employees. We have living wages for families and things like that. There's way cooler story that you can tell with these things. So trying to keep that in mind. It's really, really hard in business to not focus on those quarterly results and things like that. But we have the opportunity to, we've been successful in short term and long term. So that's what's driven that. But we're going to see some short term hits here coming up, and I just want us to keep the long term and the public to keep the long term in mind here, that we are going to be providing services to them that they've never had before, in a way that they've never seen before, and it's going to improve their lives. And I was younger and prettier when we started 2015, and we're still doing well. So that's great.
Yeah, pictures and data speaks a volume,
Exactly.
So that's good. Thank you.
Yeah.
Okay.
So taking a look at April financials, it was a tough month. You can see year to date, we have about 42 million. We're strong on the revenue side. You can see that we're about 2% over what we estimated for the budget, so that's really strong. Where the challenge is on the net revenue side, and you heard Beth talk about it, and the reason why the legislation has put in some laws to encourage the prior authorization with no AI review, and the paying clean claims within 30 days, and right now it's 95%, and like she said, they cherry pick that 5% because it's just number of claims. So 95% of the small dollar claims are getting paid within 30 days, and 5% of our gigantic, inpatient hospital claims are the ones that can just not get paid. And that is what's happening. So that legislation is going to help. But the reason I bring that up is because, after the audit and taking a look at it, our contractual adjustments are much higher than we anticipated. Our deductions from revenue, you can see we have about 22 million in a deduction of revenue, and we had budgeted for only 18 million. And that is due to the fact that we are getting more denials, and those denial write-offs are getting harder to appeal. And there was also a system issue in there where some of those write-offs were not being tracked properly in Epic in order to go into a work queue so that those denials could be worked. And so when we see the experience now, we used to be about 45% deductions from revenue, and now we're about 50%. So that's where that big hits. That number can change if our experience going forward, we're able to recoup more revenue. Legislation like that will help. We're also working with the TrueBridge team. We're working with Epic to be able to capture those things. We should be able to go back and rebill some of those denials that were missed, so we can capture that revenue. But in the meantime, that's really lowering our operating revenue. So I'm going to take a deep breath here for you all to kind of digest that. It's a big hit there. But
Patrick,
if you have any questions,
just a comment on the retro earlier in the meeting, we had Beth that talked about Washington State WSHA and all the work that they do, and legislative issues that they're working very diligently on, and thank goodness that they are, because they're impacting so much of what you're speaking of right here.
It's a challenge. It's getting harder to collect the money, and the payers, and if I was a payer, I would follow that strategy too, honestly, right? Like they're trying to protect their funds, and I get that. But they have, because they're getting the money first, they have the ability to do the AI investments that we're not able to keep up with yet. And we are working on that end too with some of the RHTP funds that we're getting, and working with the collaborative and taking a look at our central business office, and being able to, we might pivot away from our current CBO, central business office, and move to someone that is more able to reflect the modern thing that is happening in regards to denials. I will say one of our peers had to write down 60% of their revenue. So we're actually better off than that peer was with that. And this, it's really critical to know that this isn't because there's a lack of volume or lack of charges or lack of anything like that. It is we have to recognize what we're actually getting in, and so that's just a big hit to the revenue line item there. But yeah, my team loved it when I shared this news with them. So yeah, it's fun.
Thanks, Patrick.
Yeah, so we have an operating loss, which we haven't seen one in a while, right? We expected to be about 1.4 million. If we did not take that 2 million hit, we would be about break even on our operating for the year. But we are seeing that 50% write-off that we're having. So negative net income year to date, still 8 months to get through. May has been very, very good for volumes on all levels. Clinic had another one of their best days ever. The ED is doing well. Endo is picked up again. The inpatient floor, they've been seeing 24, 25 patients in May. So all the good work that they're doing is paying off. It's just my job to collect that money and the team, and we are working hard to do that. And it just takes a little bit different strategy, and we're working on those to get that done. So our change in net position, you can see a negative 4.2 million. Budget for the year is negative 3 million. So I think the thing to take a look at is our earnings before interest and tax and things like that. Taking out our investment is negative, and that's that 934 that's negative is 100% due to our payer delays in that stuff. So yeah. Balance sheets looking good. Cash and investments, again, tracking what we have, 140 million year to date in total cash and investments. AR days, you can see that $7.8 million is the 50% right off there where you see it on the balance sheet side. But total current assets about 150 million. It was 159 a year ago, but that 9 million is just what's been spent on investments there on our total current assets. Taking a look at long-term total assets, we're still 252 million as we build up that construction in progress. And you will see a similar liabilities, but our net position has taken a hit, right? We were at 9 million at the end of the year. We're now at negative 14 million. It will go negative over the next couple of years, like I said before. But it does turn positive in 2029, not just positive net income, but actually positive overall net position for the district itself. And that is a major change that has never happened before for the district, at least as long as I've been there. So that equity position will be nice to see when the hub is up and running.
Thank you, Patrick.
Yeah, cash flow. I've touched on this. Cash from operations is pretty good. We're investing, you can see. So we have outflows from investing and inflows from financing for our taxes, as well as our interest that we're earning. So our cash is about 140 million right now.
We spent a lot of time on this in the finance committee. Jen, you're going to have a joyous time capturing all of this. And I hope you find it as interesting as I do, genuinely. And it's what turns the wheel. And yeah. So
Jen's going to be our new ally to get after those net revenues. So yeah, it'll be great.
Oh, you got that. I'll be looking at every line.
I'm happy to walk you through
it. I'm here for you. Okay, Patrick.
Every line item. And the variances are important.
Yep.
So days in cash above where we were a year ago, AR down. Those are two positive trends. We know we're hiring for the hub, that going up. We'll continue to see that. Net patient revenue, I think I've killed that. Yeah, so operating net income, net patient, we'll see that flip back up closer to budget in May. So it'll be a big blip that we take the hit, the write down all at once in 1 month. Some CFOs like to spread that out over the month to kind of make it, but I figure bite the bullet, rip the Band-Aid off, let's see it. The good news is if we start recover, we'll have a swing upwards in our net revenue too. Yeah. Volumes.
Happy to take it from there. Thank you, CFO Ritter. All right,
you.
so in the interest of time, I wanted to draw your attention to one thing in particular, because I think, again, Patrick covered this really well in reminding us that we need to keep our eye to what is the long view. What are you looking at over time? But as you look at this month, I want you to see one thing, and Shauna called this out earlier this morning. The light blue line, that is 2025 actual. So that is going to be our friend as we look at these graphs. Your purple line, that is your budget. But again, a lot of the times our volumes are going to be annualized over a period of the entire year. In some cases, we do that with budget as well. And so you'll see here that the expectation of budgeted volumes in clinics, while not there yet, we are surpassing what we actually did in 2025. The other point I'll make about clinic and ambulatory volumes is the time will come when we have one provider out on personal leave, we don't take a major hit. But that wasn't the case in April. We had one of our top ordering and one of our busiest APP partners, Dr. Kaylin Reeve, a nurse practitioner in the SVH clinic. She was the volumes had to have declined because she just wasn't seeing the patients. And we just enjoy the heck out of Kaylin, but I have to tease her on that. Like when you take a day off and you go to Disneyland or something, man, it hurts. So we encourage our providers to do what they need to do, but we saw a decline in both diagnostic imaging and ultrasound, but also in our clinic volumes in part, it wasn't all Dr. Reeve, but it was in part with Dr. Reeve. And we also saw a number of providers, a number of them out on PTO, which I've talked about that over the years, but they are allowed and encouraged to take PTO. So we saw with them being out that in April in particular, we saw our volumes go down. Urgent care, however, they did a good job. So urgent care is trending above budget and above 2025 actual. So we are seeing, I think I shared, Kat Stanton had one of the busiest days we've had in urgent care. She saw 35 patients in a day, which was a record. And so that was a very big deal. And we were very pleased. And I got to give Kat kudos for handling that day, not only with grace, but keeping her teams going throughout that day. So really well done to Kat. When you're having a crazy day, it matters. Now, any questions on the rest of this slide before I take us into diagnostic imaging or into therapy?
Dr. Moore,
Yes.
thank you so much for putting it back into perspective. Perspectives as we look at, again, the trend line or the actual lines over the 2025 actual results. Yes, we set our budgets to hit the targets that we want to. But the reality is we're way ahead of last year in many instances, almost all of those instances. And so there is, while we don't hide behind things that are not up to where we want them to be, we certainly acknowledge them, but we certainly want to give credit to optimism and the reality of the result that we're achieving. So congratulations and thanks to everybody.
Thank you. The providers and care teams, everyone actually is working really hard because it takes the entire village to ensure that volumes are there. So I'm super proud, as is the rest of the executive team and our teams at large.
And I know how you jump in and fill in panels when you need to as well. So thank you.
I try. Yes, Renee will grin at me because she's like, oh, good, you get to go do patient care. I found my stethoscope. I did okay. All right, let's go on to the next slide. Thank you, Jen. Endoscopy, proud of that team. They came out of a bit of a slump that you saw in March, and in April numbers are climbing, and Patrick already shared it, but this week I think we had 15. We have got a number of cases. I think it's up to 7 tomorrow, and it's a shorter day. So really, really great work. And the report calls out Dr. Shaw, but also, again, Will Pand and others who are getting together and talking about how do we drive volume and make sure that patients have access to be seen when they want to be seen. So really stellar work there. Bradshaw couldn't wait to tell me about mammography volumes. So he partnered with Nicole, marketing team at large, actually the entirety of the team. And so we get to see that number skyrocket over, of course, budget. So at 80 exams, actually we surpassed 80 this month based on this chart. So did a really incredible job. That is just thrilling to see. And again, anticipate that number continuing to climb through the end of the year. He's going to have to beat his actual though. Yes,
Can you
go
speak
ahead.
to the distinction between the MRI and the CT volume numbers and how they interact with each other, et cetera?
I can. MRI, what you see here predominantly is our specialty. So we have with Dr. Jimmy Young, our neurologist, and of course, Dr. Yoshida, our hand surgeon, along with our primary care providers, they tends to be specialty loves their MRI. It's the type of image, and I see Commissioner Bowers nodding his head. Providers know that they can see some things with the CT and other things with an MRI, and yet another set of things with an ultrasound. And as any referring provider knows, radiology is going to call you and say, you ordered that wrong, change it to a CT or change it to an MRI. You know that's happened, Commissioner Bowers. I'm pretty sure it has, and no, it has to me anyway. But the MRI, that's what you see here. Dr. Young and others have been ordering MRI, and we're thrilled to see it. CAT scan tends to be favored by the emergency department. So it is and can be ordered by primary care and specialty, but it tends to be the purview of your ED volumes, and that can reflect complexity in the ED. So when you see a number of code strokes, you're going to see a small increase in CAT scan or CT visits as well. So they may not be directly correlated in all ways, but the team is also working on other types of ways to look at low dose CT or cancer screening, so which is done by CT. So there are screening exams that we can do preventively rather that would drive that volume up. And this is definitely on Steve Bradshaw's radar. So excited to see that over time as well. Any other questions on this slide? Otherwise, we can go on to the last. I was excited to get the report this month from MedUnit. I'm always excited to get the reports on finance graphs from our operational leaders. But the medical unit, it was a combination of Nicole, who's our assistant nurse manager, Nicole Reed, also Annette, Dr. Shaw, and I think Callista helped out as well to analyze and look at the number of referrals received into our unit, and that's into our swing bed program. They did a deep dive and were able to acknowledge additional codes that could help us understand why we aren't seeing a particular type of patient and what kind of education or training of nursing staff and or other support would be needed to keep these patients. So of the 201 referrals we received, we had a 22% what you could call conversion factor or conversion rate, which resulted in admission into the swing bed program. So that's great work. They're going to stay on top of that every month as we look at swing bed volume and then, of course, continuing efforts at appropriate inpatient. And you see a slight decrease in that trend for inpatient volume, but again, I think it's I think our volume there is 1 in terms of the difference as far as that inpatient volume. So doing very well on the inpatient side. And part of that will be working also with our specialist. That's key. If specialty is willing to say, hey, this patient can be kept here and I will round on them, that is the next step in our strategy to ensure that we are keeping appropriately patients at SVH and they aren't being transferred out of the district. Any other questions for me?
Thank you, Dr. Moore.
Thank you.
Okay. Patrick, are we moving on to approval of the warrants at this time?
That is correct, Commissioner Haugley. So you'll see the warrants a little bit down compared to what we've seen the last couple of months. We had one invoice that kind of crossed over months with GLY, so a little bit less, about 6.185 million. May we'll have some big this will be a much bigger number because we have GOI and then our $7 million in interest payments for the revenue bonds will be coming out at the end a month due June 1st. We've paid those, so expect a big warrant disbursement in May.
How much is that?
It's going to be 15-16 million. You're going to see. Yeah.
Okay. Are you ready, Patrick?
Yep.
I think we are. Colleagues, I'm going to go ahead and call for a motion to approve the warrants for April 2026 in the dollar amount of $6,185,615. May I have a motion to approve?
So moved.
Thank you. Commissioner Bowers, can I have a second?
Second?
Thank you, Commissioner Carter. That being said, motion's been made and seconded for the approval of the warrants of April 2026 in the dollar amount of $6,185,615. All those in favor of the motion, please signify by saying aye.
Aye. Aye.
Aye. Opposed? And abstaining, motion pass. Thank you very much. With that, I'm going to move on to commissioner comment. And I'd like to go ahead and call on our second most new, poorly said perhaps, Commissioner Mr. Bowers, would you please share any comments you might have for us tonight?
Yes, sir. In light of time, I'm just going to say I'm really excited. I'm very happy to see the energy and the expertise and the leadership that we're seeing with our staff and with Ms. Jensen as well. And I appreciate the board's positive attitude.
Thank you, Commissioner Bowers. Commissioner Herron.
Yes, I'd like to say thank you to everyone. I think I like that patient story even more. The more we tell our stories, the more quality and credibility we increase. And it's always nice to tell our story with supporting documents and evidence that would really make it even stronger when we're bragging, doing our bragging rights. So I really want to thank everyone. Thank you.
Thank you, Commissioner Herron. Commissioner Carter.
I completely agree with you, Commissioner Herron. You know, a lot of people were very vulnerable tonight, and they really put themselves out there. You know, big thanks to Jonathan Pearlstein and to Danny Scott for putting themselves out there and for their candidacy. Thank you to Robert also, and most of all to Mr. Sandel for putting his story out there and putting his heart out there. I think he touched every one of us. And, you know, it just one more testament. It's not just a great place to get care. It's a place where you can feel safe. And thank you for creating this environment of care and safety and nurturing. It's like nothing I've ever seen. Thanks, folks.
Well said. Thank you, Commissioner Carter. Talk about a lot of heartfelt comments. Thank you all. It's just an honor to be a part of it. And this is probably one for the record books as far as it has been a really busy meeting. And thank you, everybody, all the administrative team, Renee and everybody. Just thank you so much for all the help and the assistance and the coaching. I need it. So it's all good and I enjoy it and it's an absolute honor. Everybody have a fantastic rest of your evening and rest of the week. Thank you very much.
And
See you
before
in
you
June.
guys,
Have a nice
you.
week.
before the commissioners sign off, we are going to be raising our pride flag on Monday. And I will forward the staff newsletter to you. And I think the time is in there. If you wanted to come join us for that, we're going to try to get a photo. So we're
Great. That
celebrating
time
Pride.
is, Renee, the time is?
I'm not sure. Nicole Poss, if you're still on, if you can help me, I think 10:30, but I'll verify
Monday.
for you. I'll send it to
Monday
your
morning.
email.
Okay.
Yeah.
Thank you, everybody.
Awesome.
Look at all the
Thank you.
smiles.
Good evening.
Bye.
Good night,
everyone.
everyone.
Thank you.
Bye-bye.
Good night.
Good night.